Hullo YouTube. This is Dr. Vibes, a learning point. Discuss the regimen for anti-retrovirus. Now, this can be due to HIV-1. This can be due to HIV-2. First and foremost thing. Secondly, if you have adults or adolescents weighing greater than or equal to 30 kg, then there should be LET. L, lamivudine, which is a NRTI. T, that is tenofovir, which is again a NRTI. And E is efavirenz, which is NNRTI. Correct? Now, this regimen will be followed in all the cases. There should be 2 NRTI and there should be 1 NNRTI. So, LET. If there are adults or adolescents weighing less than 30 kilogram, then you have L, you have E, you have A. L is same, lamivudine. E is same, efavirenz. Instead of tenofovir, we have abacavir, because tenofovir cannot be given to individuals whose weight is less than 30 kilogram. Correct? Now, we have children 3 to 10 years of age. 3 to 10 years of age. You have L, Z, E. Lamivudine, efavirenz, NRTI, NNRTI. One more NRTI should be given. We will give zidovudine. Okay? So zidovudine is the preferred drug for children between 3 to 10 years of age. Correct? Next. Children less than 3 years of age. You should give L, you should give Z, and you should give L or R. Now, what is this? What does the normal regimen say? That you should give 2 NRTIs, 1 NNRTIs. That's what we are following. But in children less than 3 years of age, you should not give NNRTI. Okay? So what will be the drug here? Lamivudine, NRTI, zidovudine, again NRTI, and L or R is actually lopinavir or ritonavir, which is a protease inhibitor. I have discussed all the anti-retroviral drugs in one video. You can check it on the I button above or in the description box below. The link will be shared. Okay, this was about HIV-1. Now come to HIV-2. HIV-2, you cannot give NNRTIs because they are ineffective. So what will you give? You will give NRTI plus protease inhibitor. You can give L, you can give T, L or R. That is lamivudine, tenofovir, lopinavir or ritonavir. Correct? Is it clear? Now, come to HIV in pregnancy. If the female is already on retroviral, antiretrovirals, continue that regimen. Do not change it. If not on retrovirals, antiretrovirals, then you have to ask the patient whether there is any history of nevirapine. What is nevirapine? Nevirapine is a NNRTI. So you will ask if there is a history of nevirapine or not. Answer can be yes or no. If it is yes, then you should give lopinavir or ritonavir. You should not give another NNRTI. Okay? So you should give lopinavir or ritonavir plus the tenofovir and lamivudine. If there is no history of nevirapine, then you can give efavirenz, which is a NNRTI, plus tenofovir and lamivudine. Okay? Is this clear now? This was HIV in pregnancy. Next up is prophylaxis of HIV/AIDS. WHO has a different guideline and NACO has a different guideline. WHO says that obviously you will use L and T. What is L? Said you a multiple times lamivudine. T said you again a multiple times tenofovir. With that you have to use a integrase inhibitor. Dolutegravir or reltegravir. That is what WHO says. But our NACO, it says that obviously you use LT, but instead of the integrase inhibitors, you have to use the protease inhibitors like lopinavir or ritonavir. So there is some mismatch here, but WHO says integrase inhibitors like dolutegravir and NACO says the protease inhibitors like ritonavir or lopinavir. Now there is one more concept, that to prevent HIV transmission from mother to fetus, there is one drug of choice and that is nevirapine. Okay, that should be clear. So from the regimens, I think these questions will be asked, nothing more than this should be asked. HIV-1, HIV-2, in pregnancy, what can be done? Then there is prophylaxis, and finally there is transmission from mother to child. And from HIV, we have done many categories. What are the categories? We have done adolescents greater than 30 or equal to 30 kg, less than 30 kilogram. Then we have children between 3 to 10 years, and we have again children from 0 to 3 years. So I think this completes all the regimens of HIV. If you find all these videos useful, please do like, share, and subscribe, because it takes a really lot of efforts to make them. So please do like, share, and subscribe.